What's up, everybody? I'm Jordan Weber. You know I post all the time and probably have no idea what I'm doing. So I'm going to take you through some very simple, basic principles of FRC and let you try some of these at home. And then I'll post some new ones, maybe weekly or whatever, to help you kind of gradually get into it. So we're going to start with probably the most basic one, which is butterfly. So you've done butterfly before. You're used to just kind of hanging out here, looking at the person over here, looking over there, seeing what they're up to, and you're just really just kind of hanging out here, right? Or you might see people sit up nice and tall, but you really don't see that much effort going on, right? You're just kind of passively holding here. So what we're going to do here in FRC is we're going to wrap our hands around our ankles. And not that you don't do this in yoga, but this is just more, this is just emphasized in FRC. Okay, so you might be already doing this in yoga. You may have done this before. Nothing has been reinvented. This isn't anything new, so it is what it is. So what we're going to do is we're going to wrap our hands around our ankles, and what we're going to do is we're going to press our elbows into our thighs, or into that meat right in this area. So what we're doing is we're pushing that meat down toward the ground. All that tissue, we're pushing the tissue in toward the ground. And what we're going to do from here is, yes, we're going to try to sit up nice and tall. Now, if you're having a hard time just staying up, then just put your back up against the wall. So there's no need to have to worry about your back here. We're focusing on our adductors, external rotation of the hips here. So we're in external rotation of the hips. So we're going to be working on the adductors. We're going to be working on all the tissue, basically, that is allowing us to get into external rotation. So you should be able to get those knees almost touching the ground. You could actually put some blocks here for some stimulus. That way you know that it's there. And once you know that something is there, you're more likely to actually engage in that push down. Okay, so what we're going to start with doing first, wrap the hands around the ankles, like I said. You're going to push the elbows into the tissue. And the reason why we're kind of talking about this and holding this position now is because you kind of want to relax into this position. You don't want to just start, right? So we're relaxing in this position. I want you to inhale and exhale nice and deep. So try to inhale for 5, exhale for 10. So first, just allowing this area of the body here just to relax, just get comfortable in this position. Okay, we're not stressing anything here. We're just kind of pushing down nice and gently and passively stretching. Inhaling for 4 to 5, exhaling 8 to 10. After we've kind of settled down our nervous system, really just started to relax, next we're going to kind of fire that nervous system back on from 0% to 100%. So this is the biggest mistake. Most people, when I say, all right, let's start bumping up the intensity, they immediately squeeze. So first, just relax. What we're going to do is go from 0% to 100%. What I mean by that is we're going to try to squeeze those knees together like that, but we're going to use our elbows as a block or a barrier. So our knees aren't going to be able to go up because our elbows are blocking those legs from going up. So what you're going to feel here is tension on this side of the muscle here. So all this tissue right here on the inside of the lower legs, is you're going to feel it in this entire area, and that's the area we're working. Okay, so what we're going to do is we're going to go from 0% to 100%, trying to squeeze, closing the book here almost, kind of squeezing those muscles, almost like we're going from external to internal rotation here, but we're not, because we're blocking it with the elbows. So we're pushing it down. We're going to start at 0%, so no effort, And we're going to go to 1% effort, 2%, 3%, 4%, very light, 5%, 6, 7, 8, 9, 10. Super light tension in here, in this area. You shouldn't be hurting right now. It should just be very, very minuscule, small effort, okay? Very lightly. Let's go from 11, 12, 13, 14, 15, 16, 17, 18, 19, 20%. Still barely feeling it. Let's go to 25, so 21, 22, 23, 24, 25. Give yourself a good grip. Push it in a little bit further here. We're at 25 to 30, 6, 27, 28, 30. Holding it here. Now you should feel a considerable amount of tension, but nothing that hurts. Okay, if you're in the hurt mode, or if this is too strenuous, and you're probably at your own 75 or 80%. So now we're at 30% intensity. Let's go up to 40, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40. So a little bit more tension than 30. Let's go to 50, 40 to 50 here. Now you're starting to recruit the muscles. So now we're going to start recruiting our hands, our forearms, our biceps, our shoulders, our chest. And we're going to try to squeeze all those muscles at 50% effort. So now you should feel the entire body. Now this is called a radiation. We're recruiting all the muscles around that area into this effort. So we're at about a 50% effort. We're contracting the tissues on the medial side of the lower limbs here. We're trying to internally rotate. We're trying to close the book here. Let's go from 50% to 60%. 51, 52, 53, 54, 55, 56, 57, 58, 59, 60. So now we're at about 60% effort. Now we're starting to feel it, okay? Keep squeezing here at 60%. Let's make our way to 70. 61, 62, 63, 4, 5, 6, 7, 8, 9 to 70. Now from 70 to 80%, it's going to be really hard for me to talk if I'm actually doing it the right way. So once I get to 100%, I'm not going to say anything. I'm going to keep the intensity right now at 70%. I'm going to go up to 80%. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's 80% here. Getting very uncomfortable. That's okay. Starting to recruit more muscles. So this is our progressive angular isometric load here. We're trying to close the angle in this progressive angle of external rotation. We're at 80%. When I get to 100%, I'm going to stay there for 10 seconds, and then I'm going to start my rails effort. So now I'm at 80%, I'm going to 90%. 81, 82, 83, 84, 85, 86, 87, 88, 9, 90%. Trying to close the book. Once I get to 100%, I'm going to hold it for 10 seconds, and then I'm going to try to pull my knees toward the ground. That's going to be the opposite tissues activating. So I'm going to try to squeeze those knees toward the ground. Once I go to 100% for 10 seconds, I'm going to try to squeeze those knees toward the ground. So from here, 90 to 100. 1, 2, 3, 4, 5, 6, 7, 8, 9. I'm going to hold it for 10 seconds. Now, actively trying to pull my knees toward the ground. I'm trying to get those legs off of my elbows. I'm going to leave my elbows there so I know how much I'm getting down. I'm trying to pull those knees down, trying to further the stretch, and relax. Okay, now I'm in my newly acquired range of motion, so I'm probably started up higher. Now once we're here, we can press those elbows a little bit higher and pull those knees in a little bit more. I'm going to start that passive hold here for up to 2 minutes, or as prescribed. Okay, so this might be way too intense for you. This might take months, maybe a year to get to this level. Okay, and there's levels past this. Okay, so people can get their knees to the ground. So this is absolutely nothing. So from here, I can amp it up from 0 to 100%. This time I'm going to do it not as intense as the last one. So I'm going to go through this as a quick tutorial. First, we're going to hold passively for up to 2 minutes. Then we're going to progress the angle. Okay, a progressive angular isometric load, trying to squeeze the book closed. So contracting the tissues on the inside of the lower limbs. When we do that, we're gonna go up to 100%. Once we get to 100% effort, we're gonna begin our regressive angular isometric load, pulling the knees toward the ground actively. Okay, so there's the passive hold stretch for 2 minutes, progressive angle trying to squeeze those knees up but blocking them with your elbows, 0 to 100%, holding at 100% for about 10 seconds, and then starting your regressive angle isometric load, bringing the knees down, furthering yourself into external rotation of those hips. Okay, so this is pals and rals, external rotation of the hips. What we're doing is we're passively holding for 2 minutes, then we're starting our pals effort for 1 to 100% effort, and then we are starting our rals effort and holding that for about 10 seconds, and then going to our newly acquired range where I'm at right now. So I'm going to start that. 0 to 100% pals effort. Rals. And then passive hold to my newly acquired range. I can definitely make those hips sore in the next day if you do that. So sorry, that is definitely gonna make you sore if that's the first time you've ever done that. So hopefully you're not following along, you're just listening. Basically, that's how you're gonna expand this range right here, which is gonna help you expand this range right here, and it's gonna help you, get into this range a little bit better. And then from this angle here, this would be internal rotation pals and rals. So we just did external rotation pals and rals. Now I'm going to show you how to do it for your internal rotation. Now this one you have to do one leg at a time. So this, we did both legs at the same time, external rotation. Now we're going to go internal rotation. So the back leg is going to be the internal rotation. Front leg is an external rotation. So this is your 90-90. Your front knee is in front of your navel. Your back knee is in line with your hip, and both knees are at a 90-degree angle, and I'm dorsiflexing my feet. So your feet are about flexed like that, okay? I've seen people do both, but I'm gonna start flexed. I try to line my shin up with the bottom of my foot here, and so I'm at, if you had a line right here, it would attach. And then what I try to do here first, just like my butterfly, I hold this position for about 2 minutes. I just get comfortable. I just focus on my inhale and exhale. Just get comfortable here. If your knee isn't touching the ground here, you can put some like a pillow, or you can put a couple socks. You can put a foam roll, like a lacrosse ball here, but probably something soft where you can actually press that front knee down. Because a lot of times you see people's knee off the ground. So you're actually actively trying to get this knee ankle into the ground while you're holding this position. So try not to arc around the back. You're actually trying to keep that back straight. And this front hip, we're actually trying to do anterior pelvic tilt here. So what that does is it's going to give us a little bit of a lordotic curve in the lower back. And then what you're going to feel here is you're going to feel more stretch in that front hip. Okay? So this would be your 90-90 passive hold. And then once we get our internal rotation, what we're going to do here is we're going to twist toward the back leg. We're going to place our hand on top of our knee and our opposite hand on the thigh. And what I'm going to do here is I'm going to try to go into external rotation here. Okay, but I'm not going to allow myself to go in external rotation. Okay, and then I'm going to go into internal rotation. Okay, so here I was trying to go into internal rotation, and then I'm going to external rotation. Here I'm going from external rotation to internal rotation. Okay, so that's the difference. So now we're working the IR, which is your internal rotation. So from here, holding it 2 minutes, breathe and hold. Placing your hands here as a block. From here, progressively, this is your progressive angle, your PAL, so you're trying to open up that hip. And what we're going to do is we're going to keep this hand here and hand here as a barrier, as a block. And we're going to go from 0% effort to 100% effort trying to open the book. Okay? So we're trying to open the book here from 0% to 100%. So 0 to 10, 10 to 20, 20 to 30, 30 to 40, 40 to 50, 50 to 60% effort, going to 70. We're going to go from 70 to 100. I'm not going to talk, I'm just going to focus on my breathing. Really try to open it up, contract the tissue. Use your whole body at 100. Hold it for 10. Then internal rotation, opposite tissue. And then to get the other side, now you can hold that again and just stay here, that's fine. Or you can open it up and then switch. So switch here. Now if this bothers your back knee, you can probably bend the knee a little bit more. 0 to 100% here. So that's internal rotation, PALs and rails. Another thing you can do your external rotation, PALs and rails with the lead leg, or the front leg. What you do is start stabbing the foot, the knee and hip into the ground in this position here. 0 to 100% would be your PALs effort, and then your rails effort would be pulling that foot, knee off the ground. And if you need to, you can lean back, but you want to try to stay square like I am here. You'll see some people be able to do it. I can barely do it. Some people can get their foot way up higher. If you can do that, challenge yourself by maybe bringing one arm out or trying not to lean back, because I'm going to lean back when I do it. Okay, so that would be PALs and rails, external rotation of the lead leg. I'll show you on this side. So lead leg, stab the foot, knee, and hip into the ground. That'd be your PALs effort, 0 to 100%. Rails effort, you can feel my socket just like pull right out. Okay, And then one more internal rotation starting in bear sit. So what you would do is bring one foot or one knee into internal rotation, and then you're trying to, your PALS effort would be to go out, and your rails effort would be to go down. Okay, so that's another internal rotation, PALS and rails. Okay, so PALS 0 to 100% in this right here, using your hands as a block. Then rails effort, trying to pull your knee down away from the block. And then this would be your newly acquired range, and then you would start your next PALS and rails series right there. All right, so that's external and internal rotation, functional range conditioning, FRC, mobility specialist. Thank you for checking it out.